Olecranon bursitis. There's two types here. The most common one, or the most commonly considered one, is the one where there's gross swelling at the back of the elbow. This looks like a sack of fluid, basically, and it can be the size of a golf ball. The real problem with this diagnosis, and I'm talking about this now rather in differentials because it is important, is a septic bursitis. Now, sometimes this occurs because of an injury, direct trauma, but sometimes it's an insidious onset, and this must always be considered. If there's any redness around the area, consider it to be that, but take temperatures and so on when you do find this. The swollen one is the most easy to diagnose. It's often not painful, but it's an ugly looking thing. It's often not even tender, but there is gross fluctuant swelling at the back of the elbow. The non-swollen one is much more difficult to identify, and is often related to pain with rapid elbow extension movements such as throwing, and it's at the posterior elbow. More commonly, it's when they rest their elbow on a hard surface like a table. There's tenderness in the olecranon fossa, and you may feel no swelling here whatsoever. Passive elbow extension is painful if it's done quickly and if you're pulling up on the triceps tendon, which pulls the anconeus muscle up, and that actually pulls the bursa out of the way. And this may be negative, but when it's left alone, this becomes positive. Outliers: severe pain and swelling with a much firmer non-fluctuant effusion. The differentials, as I say, includes infective septic bursitis, rheumatoid arthritis, gout and pseudo-gout, triceps anconeus tear, olecranon fracture, lipoma and osteophytic spur.